ability at work is so high makes this. I'm Dr. Aaron Bates, and today I'm going to teach you the 5 important steps to bulletproofing your back. What does it mean to bulletproof your back? Somebody who has a bulletproof back, somebody who is very unlikely to injure themselves while working out. You have good, healthy mobility, good stability, good strength. You feel like a kid again, and they don't have back pain. Life is pretty normal. They don't really notice their spine even being there. When something works right, you don't really notice that it's there. It is not merely the lack of back pain. One of the most common things I hear people say when they come into my office is, I don't get it, doc. I didn't do anything wrong. You have to ask the question, well, what did you do right? Every day you brush your teeth. Why? Some of us have bad breath, right? But we're also trying to prevent cavities. All right, so step number 1 begins with alignment and function, which of course means chiropractic care. Now I know what you're thinking, gee, Dr. Bates, you just want me to go to the chiropractor. You're saying it's number 1 because you're a chiropractor. You have that backwards. I became a chiropractor because it is the number 1 most important thing to your back. Research is out when it comes to safety and efficacy, or how well a treatment actually gets you results. Chiropractic stands alone as the number 1 form of treatment for reducing back pain and enhancing function. Step number 2, you require tailor-made exercises for your specific back ailment. Now I don't mean just go talk to your friend who did this one exercise and it made their back feel a lot better, because that same thing that they did could actually be devastating to your particular back problem. The best person to diagnose the proper treatment or protocol for tailor-made exercises, again, will be your chiropractor. The only thing that works better than chiropractic adjustments to getting you healthy alignment in your back and better functioning back is chiropractic and tailor-made exercises when you combine those 2 things. Step number 3, ergonomics. What the heck is an ergonomic? Ergonomic is a fairly generic series of positional protocols to help you at work, or the way you get out of bed, or the way you get out of your car, that helps prevent you from any injury or exacerbation. Ergonomics are typically pretty simple once you get them dialed in. If there's one thing that you could start today, even without the diagnostics of a proper doctor, is some ergonomics. Step number 4, foundation training. Foundation training is a dynamite strengthening program developed by a chiropractor to overall work your body together, almost like yoga, but in a very specific fashion. Foundation training is something that you could do on a daily basis, whether you do it for 2 minutes or 10 minutes. This is what we call the brushing and flossing for spinal health care. Step number 5, spinal strengthening exercises. Now notice I said spinal strengthening exercises, not back workouts. People seem to have those confused. Your rhomboids, your traps, your lats, those are not spinal exercises. They fall under the category of, I guess you might call, a back workout, but it does nothing to strengthen your back, or more specifically, your spine. Some of my favorite exercises that can be implemented in any workout. In fact, you should do at least one of these exercises for every workout that you do. So you might do it, 1 to 3 times a week, are things like chops, Turkish get-ups, deadlifts, single leg deadlifts. These are all great workouts that truly strengthen your spine and take it up to that next level. Overall, you have to dedicate at least some time, much like you brush and floss your teeth. Otherwise, you find yourself being that person who said, gee, doc, I don't know what I did. In fact, I didn't do anything wrong. But typically, it's because you didn't do anything right either. I hope you enjoyed these 5 steps. Just remember to do them in the right order, especially if you have a back injury. Going out of order can get you in trouble. Many people try to go straight to the workouts when they should not even be doing any type of exercise. Sometimes exercises can make things worse. If you have any questions, just comment below. Of course, please share this video to other people in our community. The more people we share this to, the more we can help.